Hello, I'm Dr. Vineeth Mohan, a practicing endocrinologist. Today we're going to be talking about Hashimoto's disease, a very common thyroid condition. Maybe you're here because you've been diagnosed with Hashimoto's, but you really don't know what that means. Or maybe you have a family member who has this condition and you're wondering whether you're at risk too. Or maybe you just want to learn about thyroid conditions in general. Well, you've really come to the right place. By the end of this video, you'll know as much about Hashimoto's as the medical students I train in my clinic. I do need to mention that this video is not intended to diagnose or treat any medical condition, but for educational purposes only. If you have concerns about your own thyroid or any other health issue, I'd strongly recommend that you meet with a physician for further evaluation. It's best to take any knowledge that you gain from this video to your own physician who can see how it might relate to your own case. Now, if you like the content and want to hear more, please push the like button and subscribe to this channel. First of all, the name. We really have to talk about the name, Hashimoto's. Sounds very, very exotic to anybody outside of Japan. So this is Hikaru Hashimoto, born in 1881. Fortunately for us, he had a passion for thyroid surgery and pathology. In 1912, he reported on what he thought was a brand new medical condition. He had examined thyroid tissue, taken by partial removal of the thyroid, of 4 women with goiters, or enlarged thyroid glands, and he looked at this under a microscope. He found in this tissue collections of lymphocytes, which are cells from the immune system, as well as scarring and fibrosis. Being very humble, he didn't name the disease after himself, but instead used the term struma lymphomatosa, or goiter filled with lymphocytes. Later, after his death, physicians began using the term Hashimoto's disease to describe this condition, and the name really stuck ever since. If you happen to visit Japan and you're anywhere near Kyushu University, this is where he studied, you may find yourself driving on Hashimoto Street. So now, let's look at what Dr. Hashimoto saw when he first described this condition. First, let's look at a normal thyroid. It's often described as a butterfly-shaped gland in the neck, and you can see why. Inside the thyroid gland, under a microscope, what you'll see are thyroid cells encircling a pool of liquid called colloid. These cells make thyroid hormone and store it in this liquid form. Each thyroid cell is like a little factory that makes thyroid hormone, and the product from these factories, thyroid hormones themselves, are stored in the form of colloid, the liquid stuff that's in the center. The thyroid is highly vascular, so you see blood vessels throughout the gland. And in a very regulated way, these thyroid cells can take the thyroid hormone that they've made and release it into the blood vessels to be taken to the rest of the body. Now let's look at what happens with Hashimoto's. So here's the normal thyroid again, and here's what it looks like under a microscope. But this is what Dr. Hashimoto saw when he looked at his patient's thyroid glands. What you see here are cells that don't belong to the thyroid at all. These are collections of lymphocytes. Lymphocytes are part of the immune system that should be helping us get rid of foreign invaders such as bacteria and viruses. In this case, the lymphocytes are within our own tissue, the thyroid, and is causing an inflammatory response within the gland. And over time, more and more of these clusters of lymphocytes take up residence within the thyroid. And the inflammation that they produce causes destruction of the normal thyroid tissue. The little factories of thyroid cells start getting replaced by scar tissue, and as this happens, the ability for the thyroid to function becomes compromised. This can ultimately lead to hypothyroidism, or underactive thyroid. Hashimoto's is an example of an autoimmune condition. In the normal situation, our own body's tissues are shielded from our immune system. In autoimmune conditions, we lose this protection, and our immune system ends up causing inflammation in these specific tissues, such as the thyroid gland. So what we're looking at here is called histology. These slides were produced by patients who had their thyroids actually removed by surgeons, and then we can see everything that's going on within the gland. But some patients with thyroid problems end up getting needle biopsies. In a needle biopsy, a needle is inserted into the thyroid, and a small sample of tissue is removed in the form of fluid, and that fluid is put onto a slide, and we view those slides under a microscope. That's called cytology. So this is normal thyroid cytology taken from a needle biopsy. And here you see clusters of normal thyroid cells. In Hashimoto's, what we see are some normal cells, but also clusters of lymphocytes. So some of you watching may have had a thyroid biopsy, and you may have discovered that you have Hashimoto's after that procedure. Usually the biopsy was done to investigate something else, such as thyroid nodules, but incidentally they may have seen evidence of Hashimoto's. But you don't have to have your thyroid removed, and you don't have to have a biopsy to diagnose Hashimoto's. Ultrasound or sonograms are commonly done on thyroids, and sometimes we'll see features that are very consistent with Hashimoto's. So here's the normal thyroid. You see a nice, smooth, even shade of gray throughout this gland, which we call homogeneous echotexture. But here's the picture of Hashimoto's. Sometimes we see what's called a giraffe pattern, where there's dark spots throughout the gland, which are collections of lymphocytes. And sometimes we'll just see a very patchy looking thyroid on ultrasound, which we call a heterogeneous echotexture. So if we see a thyroid that looks like this on ultrasound, we start to really suspect that the patient might have Hashimoto's. But you really don't even need an ultrasound to be diagnosed with Hashimoto's. Blood tests are by far the most common way we make this diagnosis. Since this is an autoimmune condition, we can often isolate antibodies, which are proteins produced by lymphocytes, which are targeting the thyroid. We commonly measure thyroglobulin and thyroid peroxidase antibodies, which can be done very easily through blood testing. You can see that a large majority of patients with Hashimoto's will be antibody positive. There is a small percentage of the general population who will also be antibody positive, and these individuals may have a higher risk for this problem in the future. And as you can see, there is a genetic risk, since relatives of a person with Hashimoto's has a higher chance of being antibody positive than the general population. So we just took a deep dive into what Hashimoto's is from the standpoint of what's actually going on within the thyroid gland as an autoimmune condition and how it's diagnosed. But how common is it? Well, it's actually very common. It turns out that about 1 in 10 of us has hypothyroidism. The two most common causes of hypothyroidism are Hashimoto's and iodine deficiency. Now, if you happen to live in a part of the world that's colored purple on this map, and you have hypothyroidism, it's more likely due to iodine deficiency. But for the rest of the world, Hashimoto's is by far the most common cause of hypothyroidism. Okay, so now let's see how this process develops over time. And this is a process that takes a long time to develop. It can take years or decades to occur. Patients with Hashimoto's can get diagnosed at any point along this entire timeline. I'm going to divide this timeline into a preclinical phase where there's an active inflammatory process happening within the gland silently, in most cases without anybody even knowing it, and a clinical phase, which is the end stage of this process where most patients are diagnosed due to symptoms of hypothyroidism or abnormal thyroid function tests. So most patients are diagnosed here in the clinical phase. By this point, there's been sufficient inflammation and scarring of the thyroid that results in severe damage to the thyroid gland. It's assumed that about 90% of the thyroid is already damaged by this point. This is where patients start developing symptoms of an underactive thyroid. And if a patient were to get labs done, they'll be told that their thyroid gland isn't working properly. So what are the symptoms of hypothyroidism? Well, it's a condition that can literally affect you from head to toe. So let's start at the top. Hypothyroidism can result in dry hair, hair loss, depression, poor concentration, memory, and fatigue, hoarse voice, goiter, which is an enlarged thyroid, low heart rate, dry skin, cold intolerance, muscle weakness and cramping, weight gain, constipation, carpal tunnel syndrome, heavy periods, irregular cycles, infertility issues, brittle nails, joint pain, and swelling in the feet or ankles. Now that sounds pretty bad, and it can be, but I do want to emphasize that there's a varying degree of severity of hypothyroidism. The symptoms I'm listing here tend to occur with more advanced or severe forms of hypothyroidism. I should also point out that many of these symptoms are common in the general population and can occur even without a thyroid problem at all. So we always have to match the symptoms the patient's having with the severity of the lab tests to get an idea if the symptoms are likely due to their thyroid problem. Sometimes the only way we'll know is by treating the condition and observing for relief of those symptoms. So if a patient finds themselves in this clinical phase where significant hypothyroidism has already set in, treatment is usually required, and that treatment is some form of thyroid hormone replacement. We're basically giving back a hormone that the patient's own thyroid gland is having difficulty producing on its own. I do plan on having future videos on thyroid hormone therapies. But remember, this is preceded by a long preclinical phase. This is where active inflammation is going on silently within the thyroid gland. It's silent because if we check thyroid function by labs, it'll be perfectly normal. It's also silent because the patient may be feeling well since the gland is still working okay because of its tremendous reserve capacity. However, there will be some patients who come to our attention by thyroid ultrasound. Maybe their physician noted that their thyroid seemed a little large on exam and ordered an ultrasound, and it looked abnormal like the scans that we looked at before. Or maybe the patient had thyroid antibody levels done, which were found to be elevated. So I do have patients in this situation where they're told that they have Hashimoto's by thyroid antibodies that are positive or by an ultrasound that looks abnormal or both, but their thyroid function is presently normal. So these patients know that at some point in the future they might end up with hypothyroidism. I think to myself that this is probably what this situation feels like. So of course, the question is, what can be done about it? Is there any way to change the course? Or is hypothyroidism, like this collision with an iceberg, inevitable? Well, that's going to be the subject of an upcoming video. Stay tuned.